Climate change will affect our life in so many ways, and also when it comes to the health issue with skin cancer and other diseases. Therefore, it is extremely important that there is a lot of attention and also a commitment to inform the public and to try to make new research that can help us to combat skin cancer and other diseases in the future.
It's very pleasing to see so many researchers, health politicos and NGOs from all over Europe here today. I know that many of you have participated in a scientific conference on ozone depletion, UV exposure and skin cancer.
You see an increased number of deaths related to skin cancer, for instance. And I think it's very important, that's one thing I learned from the conference, that, I mean, if you are exposed to the sun, even in Denmark or the Netherlands or in Italy, this is just as dangerous as if you go on the beach in southern Spain or in Africa or in Thailand.
When do I think was the last time that a change in scientific thinking had this kind of reaction in society? And then along comes the science and says, nah, we're not over nature. We're a part of nature. We're a species like all others. In fact, we're an ape species. That was difficult to swallow.
We can see from the measurements we have made with these kind of instruments that can measure ultraviolet light throughout a season. We can see from that an average person gets around 200 risk units, and if we look at how much they get in certain situations, we can see that they get 1/4 of that just in 6 days if they travel to southern Europe in wintertime.
The human species is at risk. Let's be very frank. If we think at 100 or 150 years from now, I mean, with water stresses, with the food insecurity increasing, I mean, it's a question on whether we will be actually reaching the 9 billion population which our Earth or our planet is supposed to cope with.
The big issue is how to keep people healthy in the long term, which means that they have to protect their skins now in order to keep the risks low in later life. It takes a while before you attract skin cancer.
We can see that skin cancer screening is a good thing to detect cancer very early, especially in high-risk groups. And I think the other member states should think about whether this is also an important thing for them to implement a skin cancer screening.
It's amazing what you can do with prevention and precaution. That is much cheaper. Any money you take in your hand for prevention and precaution is much better value than when you then have to go to operations or all the follow-up of skin cancer disease.
It's important that the scientific society moves together in training physicians in being better at diagnosing, that we have screening programs as the one we heard about in Germany, that apparently have been able to break the curve for malignant melanoma in Germany. And all of these things have to come together. And of course we as a pharmaceutical industry see ourselves as one of the bricks in this puzzle.
Everything that we worry about in climate change is actually about human survival. So health is the bottom line. And if we can have, like the ozone depletion story, if we could have much more clear-cut health outcomes, then I think that would drive the whole climate change area to more global cooperation and agreement.